Hello, my name is Bill Baker and I am a student at Tacoma Community College. I would like to talk to you about gun violence and the impact that this has on public health. When we speak of firearm-related violence, we often think of the numerous news stories and mass shootings or isolated crimes involving guns. In fact, our society is unable to avoid hearing of shootings. When I turn on my local news, I expect to hear 3 to 4 stories involving firearm violence within the first 10 minutes. Gun violence is a public health crisis. This is a public health crisis not only because of the traumatic injuries and deaths directly attributable to gun violence. The impacts of this violence contribute to ever-increasing healthcare costs. Additionally, there is an erosion of family and community. Numerous long-term health conditions have been linked to gun violence. It is estimated that approximately 100 Americans are killed with guns every day. That is over 36,000 deaths every year. The majority of these deaths are not homicides. Homicides account for 35 to 40% of this total. Data suggests that approximately 60% of deaths related to firearm use are suicides. Trauma affects the individual victim. Like a ripple effect, an individual's friends and family are impacted emotionally and financially. It is estimated that over 100,000 Americans are wounded with guns each year. These injuries are often life-altering. These injuries increase individual and community healthcare costs. These injuries are associated with increased incidence of numerous other chronic medical and psychological problems, which also impacts healthcare spending. According to Johns Hopkins Bloomberg School for Public Health, there is no standardized method to collect data on non-fatal shootings. Methods vary from state to state. However, non-fatal shootings have a greater impact on healthcare resources and spending than do fatalities. Information from Giffords Law Center provides data for our own state's financial impact. Consider that in Washington state, direct costs are estimated at approximately $56 million annually. However, the cost to care for injured and non-fatal gun violence exceeds $1.3 billion. When you consider all the other downstream costs, such as work time lost, the annual cost of gun violence in Washington state is estimated to well exceed $3.5 billion annually. Some years gun violence trends down, and other years the trend or frequency of firearm-related events trend up. Effective legislation is hampered by political dogma. Meanwhile, violent firearm incidents hinder our personal and community well-being. We should educate ourselves and increase our understanding of the far-reaching effects that gun violence has on our communities. Along the lines of grassroots advocacy, by increasing awareness, it is hoped that gun violence can be significantly reduced. Some of the more effective methods to reduce risk are to secure firearms and limit access. Legislation helps, but individual and community responsibility can have a powerful influence on reducing this public health crisis. I want to thank you for taking the time to watch this video. For further knowledge, please consider reviewing the reference material found here.